Dr. Matthew DeClerc in COVID studio number 14.6. I am Aaron Bright in Hippo studio number 12.9. We are here talking about the EPM June 2020 edition, and in particular, a article by Jennifer Luong. In custody with COVID, physicians need to advocate for proper care of prisoners. There happens to be right now, where I live, prison, I don't know, it was a jail, prison, correctional facility, about a couple hours north, and it went through that facility like wildfire. Had like 500 cases in 2 weeks. It was crazy.
Yeah, it's if you think of it, similar to the nursing homes, patients
Yeah.
with high burden of underlying medical conditions, poor access to healthcare, and so
Yeah.
really one of those at-risk populations. I work in Los Angeles, and when we were worried about the COVID surge, well, I was worried about our homeless population because they have the
Yeah.
same challenges, our nursing home population, and well, our prison system population. So
Yeah.
thankfully, it hasn't been as bad yet, but it's still something we think about constantly and just waiting and trying to keep those patients as safe as possible.
It really is. It's the right thing to do, and I always put myself in the position. There's people in there that are very, you think of like, oh, prison's full of criminals or something, and that's, I guess, technically possible, but you've got a lot of nonviolent people and people there and all kinds of things, and it just, think of the terror of that as it rips through your jail. It sounds awful. So I'm in favor of controlling it everywhere like that. So good article review here by
I mean, on the
Jennifer.
bright side, Aaron, wherever you land on the law and order side, is
Yeah,
they're arresting less people for minor offenses, and they're actually letting
that's right.
people out a little bit earlier. And there's been some really heartwarming, like you said, second chances and
Yep.
people getting out, and being able to see their family again. So always a
Yep.
bright side, a little silver lining.
Yes, I like it. All right, give it a read. Thanks to Matthew DeClerc.